Welcome to Unlocking EPSDT, Transforming Youth Mental Health Through Medicaid. I'm Heidi Baskfield, host of the Speak Our Minds podcast.
And I'm Jason Hopcus, host of Nobody's Perfect. We've teamed up for this 6-part series to share something powerful, something that could transform how we care for kids in this country, yet almost no one knows about it.
It's called EPSDT, Early and Periodic Screening, Diagnostic, and Treatment. A mouthful, but it's not just a policy term. It's a legal promise that's actually built into Medicaid, and it's designed to ensure that kids and teens get the right care at the right time before small concerns become big concerns.
And here's the truth. Nearly 40 million children in the U.S., more than half of all kids, rely on Medicaid. Yet most families, providers, and even lawmakers don't know what EPSDT is or their right to expect it.
So when families don't know what they're entitled to, they don't know what to ask for, let alone what to fight for. That means kids miss screenings, mental health needs go overlooked, care is delayed, or worse, denied, and the comprehensive system Medicaid was designed to be falls short.
We created this podcast to change that, to lift the curtain on what EPSDT really means and how it can become a game-changing guarantee for youth mental health if we understand it, demand it, and protect it.
Along the way, we're going to introduce you to bold leaders, everyday change makers, providers, policymakers, families, all who are showing what's possible when we treat EPSDT like the powerful tool that it is.
And we'll explore how you can be a part of that change, especially through something called the Learning Health Network. These are collaborative communities that bring people together, families, clinicians, advocates, and researchers to share data, challenge the status quo, and improve care in real time.
So this isn't just a podcast, it's a call to action. If you believe, like we do, that kids deserve better, and if you're ready to help shape the system they need, then this series is for you.
Fall in love with what Medicaid can be. Understand your power. Join us in building a movement where every child gets the care they deserve, early, fully, and fairly.
And it starts by unlocking EPSDT. Let's make sure everybody knows what it is and how to use it. Because the more we know, the more we can demand. And the more we demand, the more we build a system that truly works.
So join us, subscribe, and share this series. Welcome to Unlocking EPSDT, Transforming Youth Mental Health Through Medicaid. Heidi, I'm so thrilled that we're doing this. For anyone who's listening, this is a series of 6 of really value-added topics around Medicaid, the importance of it, and how it plays a role in guiding youth mental health care in today's country, and just understanding the value of that program with the system level approach that's needed to really reach the audiences that it was intended to serve. So thank you for including me and being a part of this and really helping us move these important conversations forward.
Well, thank you for creating a platform that allows us to talk about something that we don't talk enough about, and we don't talk about how many people and lives it touches. And if you were to take it away tomorrow, the devastating impacts that it would create in our country.
Of course, and the pleasure is ours. The kind of thing that has underscored these conversations is this topic of EPSDT, which I want you to tell our listeners again what that is. But I guess my first question is, can we talk about what EPSDT is and how important Medicaid is in serving youth mental health today?
Absolutely. Well, when we think about acronyms that just cloud the space and make it hard to understand, what is that? Why is it valuable? I can't think of a more problematic acronym, but EPSDT is literally the largest, greatest child health benefit in the country. And what it stands for is early, periodic, diagnostic, screening, and treatment. It was created back in the 60s to really say kids should have their needs. There should be a system that helps identify kids' needs as early on as possible to ensure that we're checking in on them, the periodic, all the time, and that we're screening for their needs in a credible manner all the time, and that we then have an approach to diagnose what comes out of those screenings and then make treatment available based on what's coming out of that diagnosis. How do we understand what's going on with kids and get them what they need? That's it. and do it in a timely manner. The system is really meant to not just identify and diagnose, but address those needs as quickly as possible.
Well, and what I love about this approach is it really is focused on seeing kids and not only seeing them, but recognizing that the train may be going off the track, so to speak, or we've got some issues that we need to address. And getting to those earlier rather than later really makes a difference in outcomes and kind of a prevention focused approach, doesn't it?
Well, absolutely. The reason why Congress was willing to even put this massive benefit program into the biggest health plan for kids in the country is it was meant to be a cost savings measure. Everyone can recognize that if you're able to identify needs early and as upstream as possible, way cheaper than trying to address them once we're in those really expensive spaces and places like a hospital emergency room.
I love that. And again, in a perfect world, that system should work beautifully. I know that things don't always go as smoothly as designed, but specifically related to Medicaid as an insurer to meet youth mental health needs, like help us understand, again, the program was developed to create cost savings for that program. Help us understand Medicaid's roles, because I think Medicaid is such a misunderstood resource that we have available to us. And it really does transcend beyond just the most vulnerable and the most marginalized. And it really kind of becomes wraparound care for struggles that a lot of kids are facing that I don't think the general population at large even really understands.
Right. Well, the best way I can think of like describing the scale and magnitude of Medicaid is almost putting it in the same bucket as K-12 education in this country. Half of the kids in this country are on Medicaid, and that is how they get all things related to their health care, their physical health care, their mental health care, dental care. I mean, you name it, Medicaid is the program that is making sure that they get what they need. It is massive. 37.5 million kids as of today in this country are on Medicaid. It is huge.
Wow. And those numbers are staggering. Help us better understand like the ability and the capacity that Medicaid has to really serve as wraparound care that often stacks onto private health insurance that kind of picks up and extends where traditional insurance plans may leave off, because that's a huge benefit of the Medicaid system that most people don't even realize is available.
I know, right? Like we talk so often in the mental health community about the stigma related to mental health. Medicaid has a similar stigma. People really think of it in a very specific lane as serving a much smaller, narrower component of the population than it does. And it's underrated in its benefit as a result. And so people think of Medicaid as sort of that program that serves some of those people over there. And that just couldn't be further from the truth. And to your point on the question itself, Medicaid is like the safety net, and not just from a standpoint of people in need because of their economic circumstances, but because private insurance doesn't work well. It's not like it's working so well and we want to push everybody into private insurance. We actually have a whole subset of Medicaid that is built to serve to catch people that aren't having their needs met by private insurance. When I think about kids in particular, it's specifically kids that are living with complex mental and physical health needs, because private insurance does not work for them. And because it doesn't cover them, Medicaid raises its hand and says, we're going to make sure that just because your needs are expensive and complicated doesn't mean that you don't get what you need. And it's really a testament to how, as a philosophy, this country has said it's going to support kids. Yes, we're going to use our tax dollars to invest and ensure that you get what you need, even when sort of these free market solutions don't work for you.
Well, and I love when you talk about the stigma of programs like Medicaid. And yes, there are a lot of stigmas around social supports or safety nets. But when you reframe it in the context of how it really can stack onto or wrap around traditional insurance or to serve those that may be more vulnerable, how could we not support a program like this to begin with? But more importantly, just the understanding that we have a responsibility to meet people where they are. And some people have more complex needs. And this is a path in a direction that really helps to meet people where they are with the needs that they have specifically in a pretty clear and aligned way.
Yeah, I mean, can you think of any other insurance scenario aside from Medicaid and this EPSDT benefit where you can say, we have a whole system that requires that we find out what you need on an individual level. We're checking for it all the time. Like we want to check in with you and know what you need all the time. We built a system to effectively diagnose what's going on with you. And then we have to make sure by law that we provide treatment to you for that thing in a timely manner. And you don't get to choose. Like that's not an opt out situation. Like Medicaid doesn't get to raise its hand and go, sorry, there aren't enough child psychologists in our area, so we just tough. We can't make that available. Law says you still have to do it. Like there's no commercial insurer anywhere in this country that does that. Medicaid is unique that way.
And you teed this up so beautifully for my next question. I guess when we have this really powerful health benefit, why do so few people know about Medicaid and EPSDT and the powerful ability it has to really help solve some of these more complex problems that people are facing?
Well, I think the answer, as not a surprise to anyone, is going to come back a bit to money, in that when you think about the fact that Medicaid is a state-based program, yes, it is run in partnership with the federal government, but states have to run it. When you publicize, when you make it widely known that this is how a Medicaid program has to serve kids, obviously that costs money. And states already struggle with how to pay for the kinds of services that people need in Medicaid. And so it's not as if Medicaid in states across the country is going to stand at the bully pulpit and say, demand for more, demand for more. You are entitled to these services. And I think that is our central largest challenge is that we put state Medicaid agencies in charge of that message. And I think the reason why you and I have joined forces is to say, no, we're going to tell people that this is in fact something that they're entitled to and not wait for our pals in the state across the country to do that on behalf of people and wait for them to educate people so they know what they can expect.
So while the program may be, and I'm going to use the word, designed to be inaccessible, which is probably not the right words, it doesn't mean that it is unavailable. And that if somebody's listening that perhaps thinks that they have a qualifying condition that Medicaid might be able to meet, there are paths to get there, correct?
Absolutely. I do want to be very clear. The comprehensive design of EPSDT is limited to people ages 0 to 21. So for our friends in the adult space, I'm so sorry, but this does not pertain to our adult beneficiaries of Medicaid. It is very much focused on kids. Again, back to your earlier point around prevention, because when we invest in this comprehensive way in our kids and trying to catch them as early as possible, we're also trying to save money in their adult experience with the healthcare system. But yes, parents, youth, caregivers, those involved in kids' lives, teachers, like everyone who is involved with a child's life needs to understand that as long as a licensed provider says this is what you need, it has to be provided. Has to. Not a question. Has to be provided.
I love the power and the impact in that. And like all things, there are light sides and dark sides to most everything in life. Now that you've talked about the impactful roles that Medicaid does and will play in supporting youth, specifically with mental health, what are the challenges that kids and families can face in getting the care they need through Medicaid?
Well, I think this comes back to what we were talking about earlier around budgets and resources. And states across the country have not been consistent in their application of EPSDT in mental health spaces. And so as kids are raising their hands with the adults in their lives and saying, I need help, what needs to be brought online very quickly is the same set of resources that are available to kids who have a fever in the middle of the night, who find themselves with any other medical condition. It's very clear where you go, and then the system comes online to support those needs. Everyone knows where to go. and things come online, and then you can sort of debate whether that's going well or not. But like whether or not it's there is not the debatable point, unlike on the mental health side. So the challenge our parents and our kids have right now is we haven't brought that to bear in mental health. And that is where the work is and needs to keep being done. We all need to have that same expectation. If you have questions about what's going on with your child's mental well-being, all the things that come online when you have the same question about what is that rash or why are you spiking 102-degree fever need to be available for the same space in the mental health side.
Agreed. So, I guess just to level set the conversation, what I heard from you that I want to reiterate is not every state is the same. And the care coordination in the path, even though the system has developed a way to go, is not necessarily something that one should expect if they're in another state or in another system that maybe isn't as supportive or as adept at doing this. It's not a one-size-fits-all solution that you're going to find uniformly across the country.
That's right, which is super fun for everyone who's trying to navigate the system, right? Like if I live in New Jersey, I'm likely going to have a better experience than if I'm living in Iowa. So yeah, back to the whole K-12 analogy, right? Where you live matters a lot in the quality of what services you have available to you. And you and I both know, like, it shouldn't be that way. The good news is there's already a legal regulatory foundation that exists to compel states to deliver care and make it available in that way. So again, states can't look around and be like, "Gah, the resources we've got on the ground aren't that great, so we'll do the best we can." It's like, "Oh no, you, state Medicaid, actually have a legal obligation to ensure that the resources that kids need are there and available." So guess what that means, Jason? We have to pay people. We have to appropriately license people in a timely way. We have to ensure that resources are being incented to deliver the services that kids need, even in the furthest reaches of frontier spaces in this country. It's not a question. It's not even a debatable point. And so I think what I would say to listeners everywhere is become part of this larger conversation of expect that to be the outcome. Know that that is your right. You are not wrong to think, I just had a physician say my child needs this. I should be able to get that service. That's correct. You are legally entitled to those services right now, today.
I love the power of your words and just sitting with the weight of recognizing that this support is legally mandated to meet you where you are. Let's talk practically for a second, though. We've already acknowledged the fact that this is not perfect and the path is not always as clear as we might like it to be. How does Medicaid and specifically EPSDT, how does it impact real children and families when they're in the system and utilizing it?
It is a great question about sort of practical application. And I will say this, as you go in for your annual back to school physical, the way that this should work is in the same way you're being screened out for your physical needs. Like, are you on track developmentally, given your age? Your same physical for back to school should be asking you about your mental well-being. There should be a score of sorts that comes from that, or a flag or something that then tells the provider when you go back into the room, we need to have a follow-up conversation on this. And there need to be resources that are then in place that support whatever came up in that screening. And then similarly, as a part of that, those teams providing those resources are getting paid
Okay.
for doing those kinds of things. And it's not a one and done either. So today, I think, I'm a parent and I have young children, and most of my questions are not coming up in the physical health space at this point. Like once you leave sort of the infant toddler space, I think most of us live in questioning the mental side of things. Like that's where our questions are. And I don't have the same level of comfort asking those questions in my back to school physical. And not because I don't think the world of my pediatrician, which I do. It is more about we haven't set that expectation going forward. Like my pediatrician is trained to address whole child. And if this person isn't, then they're going to know how to handle the handoff, and I'll be able to go down the hall in the same practice in the same visit, not have to come back a different day to have those needs met, right? Like it's all together.
Well, and I think the thing that's really important to highlight here, is differently than if you and I both got diagnosed with strep throat. We know it comes from the same bacteria, and unless we're allergic to it, we're going to take amoxicillin.
Yep.
If you and I had some mental health challenges that may present and look the same on the exterior, the treatment courses could be very different. And I think it's important for people to understand that, like, while you're going to your pediatrician to meet your child's whole health needs, they were actually not really trained to assess, evaluate, diagnose, and treat those mental health conditions in the way that behavioral health specialists are. And it does require other supports and other outreaches to ensure that we're able to appropriately diagnose and, figure out a course of action to treat what your child may be struggling with. But I think most people don't understand they are different. And while our brain is in our body, and I think what's been missing in the conversation is we've never talked about mental health as just health. The way that we have treated that and approached it is still very different. The payer systems are different. The provider systems are different. The training is different. And the way it manifests in each individual person is different. Do you think that that awareness in and of itself has really contributed to the fact that we have struggled further longer than we need to, just based on the way the system was designed and maybe how it was not previously designed to show up and meet the demands that have been placed on it?
Yeah. I mean, it is a great point that the variation that comes up through a mental health challenge, by contrast to a physical health challenge, lends itself to complexity in delivery and how we meet those needs. I think to your question specifically, it feels like we are getting closer to making the kinds of changes, not just in the way that we deliver care, but even into the training pieces to create updates to how we train physicians and nurse practitioners and all, yes, and stop uncoupling of physical and mental health from one another, right? I think what you're saying, without saying it quite this directly because you're nice and letting me get to say it, is we're not going to have reached success until we get to this holistic approach to health. They aren't separate things. The longer we treat them as separate things, the more we're going to continue to have these struggles. We talk all the time about workforce shortages in mental health. It's because we say, well, only you, group of providers, can treat this lane, and all of you over here get to treat this lane. And it's like, well, yeah, it's no wonder. Like, we don't have enough people in this lane. And
Right.
so the only way we're going to solve for that in a timely manner is pulling all these people together and saying, this has got to be all hands on deck. Those of you who thought you were only going to have to deal with my broken arm, sorry, you're also going to have to figure out sort of the mental equation of this conversation.
Well, and I love that we're having conversations like this. And I think they're so important. And even though this seems like commonplace, and gosh, why isn't this, a topic that has much greater awareness? I think there are a lot of changing landscapes. I think the demands that have been placed on the system, especially post-pandemic, the integration of technology into raising our kids today, like, I don't want to vilify any one part of it, but at the end of the day, there are some factors that come into play that do make a difference, that have acerbated the problem, that really bring this really into the forefront in a way that maybe we probably wouldn't have had this conversation 10 years ago. The fact that we're doing it now. And as we started this conversation, this is a series that we're wanting to educate and bring awareness to. But I also think what I'm taking away from the conversations we're having is there's a lot of hope in this, because the more we talk about it, the more it inspires other conversations that lead to the thing and the thing and thing that gets us to mental health is health. Help us understand, the listener who's listening, what can they expect from this series? And ultimately, how can it help them take action in their own lives?
So this series is really going to help people understand with a much greater depth than they would have ever had before, really why they can expect and demand to have their kids' mental health needs met within the Medicaid system. So if you are a recipient of Medicaid services, this series is going to give you all the things you need to understand about why you get to demand the things you know your kid should have. So that's like basic from this series. The next thing is around and with experts, right? Like lots of different experts coming at this from a lot of different angles. So providers, policy experts, you name it, they're talking with Jason and I about, yes, you actually can demand and expect these things for Medicaid. The next thing about this is like, what is the advocacy? What is the action? What should I be thinking about? So we'll talk about it from like big advocacy, big A, to little advocacy, small a. And we'll start with small a. It's as simple as going into the appointment that you have scheduled for your kid and expecting to have their needs met that day. Like you should go into this equation expecting that your kid's needs are going to be screened and addressed and that your kid is going to get better. That's like little a in the course of the interaction with your providers. Big A is if you sort of pop your head up and look around a little bit, you may have noticed that Medicaid is under threat of being defunded. $880 billion in cuts are currently being contemplated by Congress and the White House. That is like wholesale program termination. So imagine if I said to you tomorrow, we no longer have a K-12 system of education in this country. Figure it out. We'll give you a tax credit you can figure out. There's no like something else you can look to provide what Medicaid does. It does not exist. And so the big A is talking about why it is so valuable to have a program that already has these guarantees in place and why you want to keep it going. You want to see the momentum that we're already building in this space moving forward, not eradicated. So it is a reach out to your congressperson and raise your hand and say, I love Medicaid. I know it's not perfect, but look at what it's already in place that we can build off of. And how else are we going to solve this mental health crisis for kids?
Again, I go back to meeting people where they are. And I think what's proving out in this country is, collectively we feel like a pot that's boiling over. And people are maxed and just tapped out on what else they can take on. I cannot reiterate enough based on the words you just shared with us, how important it is to have those next level conversations, even if it's not directly impacting your specific situation. It could be someone you love. It could be one of your kids' friends at school. Like, it is important for us to look at this as a community focused approach that is really rooted in connection and seeing people and ensuring everyone's needs are met, because, this is the future of our country. So, if you're listening and I know you're tapped or you're maxed out, like really take a step back. You're here, you're listening, and I'm grateful that you're here for the conversation, and recognize that there may be something else to do. And it matters. It's important that we have these conversations. It's important that you take that next step to call your congressperson and let them know that this is a valuable safety net that you want to ensure exists for this generation and beyond. Like, that matters.
Matters a lot. And it matters to go into a medical appointment with the expectation that you're going to get what you need. They both matter a lot.
Heidi, I have really loved this conversation and just am so excited about the opportunity to do this series with you and know the conversations we're having with the experts in the field from various acumens that are really coming back and adding to the richness and fullness of why this conversation matters now. Is there anything else we didn't cover today that you think really needs to be part of the conversation to get people excited about what we have for them?
I think just ending on the note, like, there's hope. We're not just like circling the drain. There are ways, there are expectations, there are things, and stick with us as we keep having this conversation.
I love it. So on that note, we will end here, and I look forward to seeing and connecting with each of you as we move through this series of 6 and have some really incredible and valuable conversations. Heidi, thank you for your invitation to support this work and for the bright light that you shine and just making us all aware about why now and why we should be having these conversations. It's important. I appreciate you.
I can't think of a better partner. Thanks, Jason.
Pleasure is mine. Take care.